A cognitive developmental delay, it refers to the condition of children whose intellectual function and adaptive behavior are significantly lower or say below the expected average for their age. You might have seen the usual interaction that happens in the school with the children for admission for their preschool. They might ask the child to identify some colors and place the blocks in its place or tell a rhyme, etc. Now, these questions are generally asked based on the age and the grade the child wants admission for. Why do they ask? Why don't they simply give admission? These are some of the questions that I come across during such interactions. Now, the interaction is held to understand whether the child is able to understand, think, analyze as per his or her age. Now, whether the child meets the expected intellectual function that is present on an average of the same group. Now, coming to how do we know that the child faces a delay in cognitive development? Let me give you all hints or for watching out. Achieving milestones late compared to other children of the same age group. Trouble understanding simple instruction. For instance, a child of age 5 not able to follow an instruction asking him or her to sit straight, or an consequence when said, I will not give you a candy for what wrong you have done. A child of 7-year-old whose understanding ability is that of a preschooler. A child of 4 to 5 years still not able to achieve toilet training. Now, what do we do when we encounter children with the above delay concerns? Firstly, need to accept the fact that the child has a concern which needs attention. I have seen many parents who simply say things will turn normal as they grow. Or I have even seen grandparents saying that their children also had a delay, so which was sorted out as they grew up. Trust me, it's very difficult to accept that our children has a concern, but realizing it and thinking of what next is very important, because early the intervention, the better chances of progress. One need to visit your pediatrician first and describe them all the symptoms of their children without hesitation or hiding. They might want you to visit a developmental pediatrician for a thorough analysis. Now, professionals evaluate and diagnose what is cognitive delay by looking at two factors. One is intellectual functioning and the other one is adaptive functioning. What is intellectual functioning? The child undergoes a test. It's a simple test to measure the ability to learn, solve problems, or understand the world. Sometimes it's also referred to as an intelligent quotient or an IQ exam. Then comes adaptive functioning. The child undergoes an evaluation to determine ability to develop skills needed to live independently. Now, what next? Yes, there isn't any exact cure for cognitive delay, but we have many professionals who are involved in early intervention, which included the individualized education plan along with the therapies, which involves speech therapy and occupational therapy. As parents, you too can help your child alongside by reading bedtime stories aloud and making them repeat in case of speech concerns. Practicing 2 to 3 letter words every day to familiarize them on it. Working on home-based plan as per the therapist. So if your children or any children whom you know faces any such concerns, please do go and tell them to visit a developmental pediatrician for sure.